Tēnā, tēnā. Aku mihi kia tātou e tau nei, tātou tūhono mai nei tēnei rangi. Koutou e mahi nei kei roto i ngā whare hauora. Ko ngā ratunga hauora huri no te motu. Mai te tokarau ki te tonga, tēnā koutou, nau mai, haere mai, piki mai. Kuhu mai ki roto ki tēnei wānanga a ipurangi, tātou e kōrero mō ngā mahi kei wainga i a tātou. Ko taku mihi ki a koutou katoa, nau mai. E pēnei ana tāku nei me tētahi paku karakia, ko ngā āhuatanga ki ronga, ko ngā āhuatanga ki raro. Ko ngā āhuatanga ki ronga, ko ngā āhuatanga ki raro, ki waho, ki roto. Ko ngā āhuatanga o te Aotea kitia, kia tau ki rungi a tātou te manaakitanga o ngā mātua tīpuna hei arahi a tātou tūturu whakamaua kia tīnā. Haumi e hui e, tai ki e. Welcome. Thank you for joining us tonight for this webinar about Omicron, and specifically our audience tonight is people working in Māori health providers, Māori social service providers. We had a webinar a couple of weeks ago and we really touched on a wide range of topics, and some of the feedback that we got was that we should focus and have a conversation in a more focused way, and one of the areas that we agreed to do was with Māori providers. So thank you for joining us tonight. I'm really excited. We've got three wahine toa who have agreed to spend some time talking about their experiences. They get 5 minutes each. And then we're going to switch to a question and answer, and that's in your Zoom. The Q&A function is a place for you to type your questions. We've got a group of people who have joined who are going to type some answers as we go. And sometimes we'll pick out some of those questions and we'll throw it to the panel. Nō reira, ka mihi ki o koutou, e nai nei ka huri a hau ki tētahi ko tūhono mai, mai i tēnei o ngā ratunga hauora i tāmaki nei, ko ia tērā e tiaki nei i Ngāti Whātua o Rākei, ka mihi kia koe e Teara. Haere mai, over to you.
Kia ora koutou. Thank you, Rauri. I've been told I've only got 5 minutes, so I'll share my slide now. And get straight into it. I'm not sure if everyone can see this managing COVID. Yes?
Yep, it's looking good.
Great, fantastic. All right, how do I turn that into slideshow? There we go. All right, so just quickly to start off with, we started off in May last year as a vaccination centre, and then when the Delta lockdown hit us, we then moved ahead and opened up our testing station in Glen Innes. We're based at the Tamaki Vaccination Centre in Glen Innes, and then from there in about November, we supported the development of merch and created what we called our Noho Tapu or Whānau HQ team. And so we supported Whānau Free Delta, and I'll quickly move ahead. And so initially we were mostly looking after high priority whānau, but as Omicron has come along, our work has really changed. And so the way that we received our referrals or whānau are coming through is we've got quite a few different pathways. So obviously we've established a 0800 number and a call centre for our, originally mostly for our Ngāti Whātua o Rākei whānau, but soon within a week it made its way to the wider population, and so we just received call from everyone across Tāmaki. We also have a dedicated email address. We're getting referrals from merch, mostly our high cases. So that's Rauri and his team. Some of our referrals are coming through MSD, and then obviously we have other Māori providers and services that come through to us with some referrals of whānau. And so what we do with our 0800 number, particularly in some of the referrals we receive, is that we kind of do a real fast assessment. And so we will categorise whānau in low, medium or high. And when they're low, ideally, we would ask them to self-manage. We do deliver them what we call an oha manaaki or a kaipack. We give them some education on how to safely isolate and when to contact emergency services or call us back if they have any questions, and what symptoms to watch. And that's mostly what we do with our low cases. We are seeing about, initially we were getting about 100 phone calls through our 0800 line, above all the other referrals we were receiving. And so that's why we've made the self-manage for low risk patients. And then any of our medium to high risk whānau, a lot of them are either not engaging with any GP or health services. They have high health needs. We've seen a lot of cancer patients come through, people with long-term conditions, those that are not vaccinated. And we've decided to put our kaumātua in the high risk. And the main reason for that is obviously the age, but a lot of it we've seen kaumātua that are living on their own. And so to us, that was a concern. For most of them, they do well, but we still felt that we should look after them more frequently and make sure we're checking in on them. And so part of it is we will provide the same as if you are on a low risk. So you get a kaipack, some information, when to contact us. We will also check in with GPs if they need extra clinical support, but we will do daily check-ins and daily phone calls, or we agree on a time frame, whether it's every 2 days, every 3 days, depending on the whānau, and they know how to contact us as well. Quickly with Omicron, one of the things we've had to do is we've established our distribution centre. We did that pretty much overnight, and it took a little bit of time for us to figure out the flow. But as you can see, we started off with delivering quite a lot of rats. It seemed like that was the highest demand that we were getting from whānau. And then slowly we started to see a lot of deliveries for kaimanaki. And that's usually what our van would look like as it heads off. But it's often full to the roof. And we do also try and encourage whānau to come and pick up if they are able to, or if they have a COVID cuddy, then we often ask them to come and collect that for them. You'll see on here that we deliver water. At one stage, we were going to rural areas, and what we found is a lot of our whānau were living on tank water. So we made sure we were providing some drinking water for them. And this is just a small slide of some of the oha manaaki or kaipack that we're providing whānau. And so as you can see, you've got your pantry items, you've got your meat. So we partnered up with the Mad Butcher, and he provides us what we call a whānau kaipack, and there's 2 sizes depending on the size of your family. And then we've tried and incorporate some veggies, and we always provide bread, milk and butter. And then we also give out some hygiene items. And often we'll add in face masks, hand sanitizers and other things that they might need. Our team also has access to Panadol, if needed, lozenges for the whānau that do require it. And we also try and give out our COVID whānau plan as part of it. All right. And that's it really, Rauri. Did I make your 5 minutes?
Yeah, kia ora. Thank you, Teara. Look, I know that that's going to generate some questions people are going to want to ask. And I think we should just notice as well that all of this oha manaaki work comes on top of vaccination, and just an incredible contribution that your team has made in terms of vaccinating Auckland. And that comes on top of testing. And again, incredible mahi that you've done in terms of making sure that people got access to tests. So, ngā mihi ki a koe otira ki o koutou. We'll come back to you with some questions, so don't go away. Mea huri a hau ki a koe e Terina. Me te tei paku kōrero mō Raukura Hauora Tainui, it's my pleasure to introduce Terina Moke. She's been with us previously in the webinars. Thank you. Kai a koe.
Kia ora tātou, kua wehi ki te atua whakahonorotia tō tātou, kingi tu heitia pō tātou te whero te tuawhitu, tēnā tātou katoa, pai mariri, ko Terina Moke ahau. My 5 minutes is, and really is just to echo actually what Teara has talked about in terms of the mahi in which Ngāti Whātua is doing, and that I can recognise some of the same things in which Raukura is doing, and probably most, or if not all of our Māori providers are doing. But in my kōrero, I really wanted to just to touch on a few things for my as a Māori provider, and one is burnout, supporting our kaimahi, and dealing with the funders. So just quickly, in terms of dealing with the funders, really it's to say that all of us are having to do some form of BAU, and on top of trying to run a COVID-19 response, and then trying to utilise the same kaimahi to do mahi across a whole lot of contracts. Is this new for us? Definitely not. But is this, with the intensity and the demand of the COVID space, it's created quite a lot of, I would say, stress for a lot of providers in managing BAU and then also doing a COVID-19 response. And then also to say that not all funders are equal. So some of the relationships we have with our funders are very different, you know, ministry, counties, blah, blah, blah. Do I have an answer to how we do that? No. All I'm recognising is a big pain, point of pain for us, for Raukura, and probably all Māori providers, is trying to manage that. The other thing on top of that is I'm cognizant that we all now have to pivot again, because we all geared up to do vaccinations, testing, and now that's kind of like starting to really dry up and quite quickly. Then we've got this really, this new workforce that we didn't have before, that we all want to then pivot and utilise them and keep them within our providers, within our respective organisations. So I'm keen on that. And then really lastly is burnout. It's been hard graft since March 2020 for probably all of us, in trying to mobilise and collectivise to respond to COVID. I would have to say this year, from last year, we did recognise that this year probably with Omicron was going to be even harder. And we're at the halfway through March, and I would say, yeah, it's hard. Just the demand, we've just noticed the demand around whānau isolating and in demand for welfare support, not being enrolled in a GP practice, no one rings them. Things are promised to them, never turns up. And providers, Māori providers, are really stepping up into the space to try and fill that gap. And it is, and then finally, I would just say in terms of funding, we've all experienced sometimes the funding is promised, but then it comes like 4 months too late, or 4 months after the fact. And that has impacted on providers financially, even though we do get the money. I think there is that. I think this year I've noticed a bit more trust, a bit more of a high trust relationship with the funders, and not being so prescriptive to what they were in 2020 and even last year. Particularly make reference to Hauora, the commissioning agency. They've been great. And also for us, to Waikato DHB, but I do know that that's not the same story right around the motu, and that's an equity issue. I know I've said a lot of statements, but hopefully I can provoke some pātai. That's me, Rawiri.
Yep, you're provoking whātai, all right. They're coming in. We're going to hold some of them and bring them back to the panel. But now it's my pleasure to invite Iringa Davies, who's been working with Ora Toa for, and I've known for years, but ka mihi kia koe te tūāhine. Nau mai, haere mai. It's really great. I'm really grateful that you have agreed to be with us. I'll turn it over to you. Kia ora.
Kia ora Rawiri, and kia ora koutou everybody. I'm going to come at it a little bit different of an angle. First of all, just to acknowledge the mahi that we've done since the beginning of the pandemic. So 2020, we were early in setting up our testing station in Porirua. Following last year, we've got the regional or the Porirua Region Vaccination Centre. And just in this last few months since Omicron, we've set up our own hub for our Ora Toa patients, where we have GP and nurse support, but also welfare for the whole of Porirua, our Tiaki hub. So we've been lucky enough to get the funding to be able to do those things very quickly, and we've been lucky enough to have support from not only our GP practices and our community teams, but also from, especially with our Tiaki hub, we've actually had support from Two Ora Campus as well, which is great. So we've seconded some staff over to that space as well. I think the biggest thing that we're finding now is, because at the moment I'm general manager of the health services for the Runanga, but I'm actually seconded in setting up a youth one-stop shop, and I think it's the rangatahi that are falling through the gaps, especially with Omicron. They're either not registering that they're positive, or they're slipping through the welfare system, or they're in a household that are isolating and their specific needs are not being met at the moment. So we're trialling, we actually started it today, where one of our rangatahi support workers is actually working in the Tiaki hub and is there to be able to give one-on-one to the rangatahi in the isolating whānau, which today has been a great success, and it looks like we're going to have to second more FTE into that space moving forward. Our GPs from Ora Toa, we're very lucky. They're all on a roster and working weekends to do initial assessments with our whānau, whereas the rest of Wellington are reliant on Texas or Healthline giving them a ring. Our welfare support has gone through the roof, and the demand for kai packages is just shot through the roof since last week. I think we did just on 2,000 last week of kai packs. There's a real issue with whānau not being able to access the support they need in a timely manner, either through online shopping. As everyone knows, probably there's a 3 to 4 day delay in getting any online shopping. Medications, that kind of thing. We've had GPs that have gone out to door knock just to eyeball kaumatuas and really high risk patients to make sure they're actually okay. Our support team from our community services team distributing rats for the region, so that includes to all our kura as well. So we're distributing them for the whole of the community, and other providers too, 2 other Pacific and Māori providers within the region as well. Where, like Terina said, there's been a lot of staff burnout with just the pure demand on our service. We're the only ones, apart from GP services, that were doing testing when Omicron hit. So we had huge delays that our people were facing and getting tests. What else? I think the difference with us is we really haven't had a lot of issues with getting supplies like PPE or rats, and I think that's because it's the DHBs and the ministry have trusted us to be the main response within our rohe, which is great. Our older patients, one of our practices in Takapuahia is looking after all of our kaumatua, which is awesome. And I think generally in that area, our whānau are feeling quite well supported. And I think that's about it, really, Rawiri.
All right, kia ora, thank you. Really appreciate it. And you are generating questions. So whānau. And wow, there's neke atu I te ko tahi mano ko tūhono mai, ko te taki tini ko tūhono mai, ngā mihi. So if you've got questions, provocations, you type it into the Q&A. We're going to supply some answers to some of that. We're going to provoke some conversation with our panelists. And the question meister tonight's Dr. Anthony Jordan. So over to you.
All right. I know this was one that we discussed, Teara, around distributing paracetamol and what we did to keep the amount of paracetamol safe going out and what we provided. Do you just want to talk about how that was for you guys in terms of getting that out there? Because it's obviously small packs when you're buying it at the supermarket, but a lot more use when you're giving it to a household of 6 or 7.
I think for our whānau that are symptomatic, we've passed, so our call centre, our kaumahi will pass that on to our clinicians, which is, we've got free registered nurse to answer the calls, and they will give out Panadol after having a conversation with whānau explaining dosage, and they also work under the supervision of our GP now. Initially it was Rauri, so we had Rauri on speed dial to provide us support with not just Panadol, but any medication. And it's also for whānau who are on regular medication or and they often have questions. And so that's how we've dealt with it so far. Yeah.
And so the other thing that we did is we kept the pack size to what you could buy in retail space. So unlike when we prescribe it as doctors, we can give out a lot more. And we also did up a 1-page sheet about how to use paracetamol properly, just so people had some information around it. Because, I've opened a Panadol pack and it's got that little fold up in it. I can't read that. So we just did a big 1-pager just to keep it simple and just give people guidance around that too, to keep them safe.
I really liked the question though, because the person asking the question is saying, if you're not a health provider, and great, we've got Māori providers who are not health providers, and the panelists are all health providers, have done it for years. Ngāti Whātua Rākei, Raukura Hauora Tainui, and Ora Toa. And so they are all health providers. They're going to join it up with clinicians and all the rest of it. So for you that are not health providers, I think that's really good advice. If you could go to a supermarket and buy paracetamol, you can buy a pack of 20, no worries, it's safe. You could buy a couple of packs, just saying. And so that's the kind of scale that would make sense to go into a kai pack. If you're supporting whānau, I think having 20 or 40 tablets is definitely the right place to be. There'll be 2 or 3 adults that can, receive that, and it's going to help them get through, a couple of days of needing it, 3-4 times a day. Having the sheet that explains how to use it, really helpful. So something in that order, the retail space, I think is a good way of thinking it through. Otherwise, do reach out and try and join up with a healthcare provider who can support your service. Yeah.
And one thing that someone is on from last week, and I remember this question coming up, is for whānau that are living a far distance away from their iwi, and so how do we support those people that don't have local iwi affiliations? And I'll open that up to everyone.
I'll start maybe. For Ngāti Whātua, early on in the Omicron, what we realised is that we were getting requests from Auckland, from Tāmaki, but quickly we had whānau across the motu calling us, Ngāti Whātua Rākei whānau calling us. And so we went against the rules and did some things that we shouldn't be doing. And so one of them is rats. Rats was very difficult to get. So whānau were really, really struggling to get rats. And so what we did is simply took some of the funding we had and just posted it to them. Ministry might not like that because they've told us it's for Tāmaki, but hey, if whānau across the motu need it, then we send it to them. We also access funding through MSD to be able to give what we call some OHA grants, and so we've provided funds to whānau across the motu to support them during Omicron, during the isolation, and that can help. We can also support with rent and power and things like that. So that's something we did early on with Omicron. Within the first week of really being stretched, there was no other way with Tamaki being at really, you know, we were seeing high number of cases and a big demand. That was probably the only way we saw we could support whānau.
Kia ora, with us, we set up very early on an iwi hub where people from all over could ring in and ask for support. And at the moment with Omicron, what we're doing is we're directing them to other whānau water providers around the country, because that seems to be the easiest way that they actually get some help.
And with the Raukara, Waikato Tainui led that one out through their call centre, and we're running a big kai hub. And then we've got divisions within Waikato Tainui that have their own hub and stuff like that. But similar to what Te is saying, we would refer on another takiwa. And the other thing to remember is that actually we were also looking after people in our takiwa that weren't from Waikato, as you do, as we all did. Yeah.
Yeah, and I think that's the message, isn't it? That's what we've all done. We take care of the people that we need to when they reach out to us.
I think some of the tribes have done something extra. I remember a time when whānau Apanui was doing a bit of a reach out service, and I think Maitahu's done some of that. So it's going to be a bit of an overlap of those sorts of things. Yeah.
All right, there's lots of questions coming in, which is great to see. Some people are just coming back to what you would, or everyone was talking about, but you in particular, Terina, about how do we actually manage burnout in the midst of the burning fire?
I think there's a couple of lessons learned. Big lesson is not working 24/7, and that is much as me as anyone of any of our kaimahi, because we all got burnt out. Well, we all have experienced it. So for me, the biggest lesson is actually learning to say no and learning to prioritize. And so for us, and so the first thing was I don't want people to be working, I want them working 5 days at a stretch. They can work 6, but they have to take a day off. So it's things like that, and really holding the line on that. The other thing is to be really cognizant of well-being stuff for whānau, for your kaimahi. For us, we're quite lucky. We have access to waka haurua out in Kawhia and then up in Tamaki. So we did day sales for, because we've got lots of bubbles in our organisation, and they went out on the waka for the day. And it was really just to relax and to do a bit of planning, whakawhanaungatanga. I find doing things like that, being really flexible with kaimahi, and it's a high trust relationship around what's going on for them and their whānau. And particularly the amount of our kaimahi that are having to isolate, and being supportive of that, reaching out to them. It does make a difference when the CE sends a text to every kaimahi that's tested positive and asks how they're going. It does make a difference when the leadership within your provider reaches out and personalises things. And then sending things out. So we send out like a big kind of a fruit basket to our kaimahi who test positive. And then, we try and be available to them to help them while they're isolating and getting better. There's things like that. I think the way in which we communicate, and then creating opportunities for kaimahi to take a break, so rostering, moving them around. You know, people, you get a bit stir crazy when you have to do 6 months on a vaccination team. So it's about rostering people around so that they get more variety. Yep. Kia ora.
Kia ora. I'll tell you, one of the things that we did was make sure that all of your staff have got things in order. And sometimes they just need time and a bit of instruction. Okay, like it's really hard to work at the front line if you're worried about home. So here's the plan. Everybody gets home sorted because tomorrow we're doing front line. And some people needed more than one day, and that's cool. But just give people permission to get the home stuff, get the whānau stuff sorted so that they can be present when we need them at front line.
And recently we sent out a sort of pack to all of our merch staff, just to sort of, as a thank you for all the hard mahi that they've done, but also to prepare them to say, hey, we know that COVID is going to touch all of our homes, hopefully not all of our homes, but some of our homes soon. So here are the things we can do to make sure that you're safe and set up to do that. Which I think, yeah, it's an early preparation. So we've got lots more questions coming in. There's a couple of questions around for, I guess, all of you. When you see there are people that we've engaged with, and then there's the people that sort of fill the gaps that don't necessarily have a relationship with any, whether it be agency or provider. Where do you sort of see those people sort of turning up at the moment? Are you picking them up, do you think, or have we still got a gap in the system there?
Well, I think they are coming through, but there's certainly, especially for us, there's still about a couple of thousand, at least a couple of thousand of porirua that aren't enrolled anywhere. And we're trying to work a process through with the DHB where we can give these people more support. Yeah. I think there are some that are falling through the cracks, absolutely.
I agree with Tay. I think any door is the right door, and when we get people that turn up, then you know, I view it as an opportunity. You deal with their immediate needs, and then if the door is even pushed further open and they want to have a kōrero about enrolling into a GP clinic, and then we'll go there. But the other thing I think for providers too is that sometimes we're not the best door, and sometimes it's another organisation in a community that actually is the best door. Then our job is to dovetail and support that organisation, regardless of who it is, so that in our own way we can support what needs to be done. So I don't get hung up that it has to be raukura. Any door's the right door. Yeah.
Go ahead.
So yeah, we've kind of adopted the same thing here, and we've tried to engage with as many people and link them up to the services that they need and the funding they need to reach out to their communities. Just because it's a lot easier to use existing pathways where they exist rather than hoping that you're going to fix it this time around. That never seems to ever work. Well, I don't think I've ever succeeded anyway.
Can I interrupt you on the questions? There's a deadly one from Courtney. It says, can we awhi our whānau safely to navigate through the new digital framework? And she clarifies that. It says, I'm referring to the rapid antigen testing, the reporting. And I think the answer is yes, please. If you can help whānau navigate through that, like totally. Lots of people are struggling with it. And so giving that assistance is going to help in a number of ways. Gets their rapid antigen test result loaded up. And that's important long-term because you've got a result recorded and that you really appreciate that. And it's also a gateway into, accessing some of the services in Kai and Manaki and stuff. And like Terina just said, any door is the right door. So if you can help people get through that, beautiful. Thank you.
There was another question that came up around the use of thermometers and pulse oximeters. And I guess our view on thermometers has been, most people know if they've got a fever, that kind of don't need a thermometer to tell them. You know, you don't really need it. Pulse oximeters were really important during the Delta outbreak when we saw a lot of lung involvement, people were breathless. Omicron tends to give more upper, you know, sore throat, runny nose, still a lot of cough and uncomfort. So we've thought about, well, how do we use those pulse oximeters for the people that may end up getting more lung damage? So I guess, you know, it's probably still for the high risk people out there, our older kaumatua, those with pre-existing lung conditions, for example, that may, you know, just sort of tip over the edge. We've actually adopted a sort of 3-question screening that sort of asks someone, what's your breathing normally like, and is it changing? Are you finding that you're more breathless doing things that you could normally do yesterday or normally do in your house? Because for a lot of people, that's something that they can relate to.
Yeah. I guess being 300 k's away from a hospital, that's an issue, tertiary hospital or not, I guess. And I'm kind of keen that providers are kind of accessing the existing supply of oximeters. Like, yeah, I'd like you to avoid spending money on oximeters if you can get into the system, the Ministry of Health system, and get access to those oximeters and still use them wisely, still use them for the patients who mostly need them. That's the best place to be, I think.
But never delay the question, because, you know, the further you are away, the harder it is to get the thing, let alone to get it out to the person. So you could be 5 days deep into this, whereas you can always ask the question every day.
Yeah.
So don't become too dependent on the thing when actually you may be just as well equipped talking to the person as well. Another question that's sort of come up is around, do we think that the definition of COVID death will mean that deaths due to COVID will be understated?
Well, I thought probably not, to be honest. I think we're recording deaths really diligently here, and somebody's got COVID and they die, we're reporting it in that sense. It's certainly different to other jurisdictions where they quickly went to a place of trying to say, yes, some people die from COVID and some people die with COVID. Now that's true, but if the system's starting to try and run that narrative, gets me a bit worried. I think we are pretty much reporting appropriately all of the deaths with COVID, and over time we'll narrow it down to being pretty clear about which ones are from COVID. But it's really important that we report. I'm a little bit worried that we're not recording ethnicity data with the deaths currently, and I think we can do a bit of advocacy around getting that right.
Yeah, and the thing is it's there. We just need to make sure we report and link on it. There are a couple of other sort of more comments in there that we'll probably just talk about at the end. One really good question is, how have we been able to work with those whānau that have serious mental health issues and disability issues in dealing with their physical health concerns in COVID? Have you guys had any experience of supporting in that space?
We've run low sensory clinics for ones with disability. Our mental health teams have been doing a lot of phone calls to their Hauora. We're starting to do the same with our rangatahi. And yeah, I suppose that's it really.
Yeah, we're doing the same, working still lots of phone calls. We're doing visits, home visits, in terms of just standing at the at the fence and having a kōrero. We're also doing pickups for people to get their injections, and we're also working alongside couple of other Māori providers in South Auckland to do vaccinations, either at their whare or bring them in. So we're trying to, and we can't do this alone. We have to work alongside other providers. Yeah, and it's hard. I think in this space particularly, it's a really hard space at the moment to work in. Yeah.
Just to add to that, we're probably doing similar to the others, but it's also giving whānau some kind of what I call street smart messages around when you're isolating, and things like you can still go outside, you can still go for a walk. And in Auckland, what we're saying to whānau is, wait till it's later in the night maybe, and go for a walk, because often they'll say to us, if I go for a walk, there's lots of people outside. So we say, well, wait for a time or early in the morning when there's not so many people and go for a walk. Don't stop doing things that support your well-being because you're in isolation. Eat healthy if you can, if you've got the means to, reach out to whānau. And I think it's quite important to keep exercising, is if you've been doing that to support your well-being and you stop all of a sudden, it's just going to exacerbate your situation or how you're feeling. And so we try and encourage that as much as we can in our conversations. But I think it is a hard space, and being in isolation is probably making it worse for a lot of our whānau. Yeah.
It's always been a hard area to support, and it only just got harder with this, didn't it, really? Just one other thing that sort of come up is around tying people in, and we've had this problem through Merch, and I know is with MSD doing some provision of support, and not necessarily identifying maybe the people that we think need support or who are asking for support, how we've managed to continue to provide that around the edges. So, for us, we've, yes, they can go through the MSD process, but we also have a direct to provider pathway as well to get people what they need. And Teara is always helping us out in that space. I guess for Terina and others on the call, that there are some difficulties in terms of funding pathways, that sort of people are worried about being means tested, and other sort of problems with MSD. I wonder if anyone else has had sort of similar sort of feedback from whānau.
We've been quite lucky because we've had one of our trusted whānau members working in from MSD, working in our services for probably close to coming up probably close to 2 years since the pandemic. And she's still working for us and is supporting us in the Te Aki hub space. So not so much those problems directly to us.
Okay.
I would say for us, we have had a lot of whānau that want to stay off the grid, and but we're not there to play decision maker around that. We just, if there's need, and we'll address the need. And I make the point, Raukawa is a big provider. It's a different story for a very small provider in terms of trying to service your community, but only having, not that much putia to play with. Bigger providers like us, Ngāti Whātua and Ngāti Tō, we can take the hit. Do you know what I mean? So if we've got part of our community that we can't claim funding for or anything like that, we can actually technically take the hit. Whereas smaller providers may not be able to. So I also think that actually as Māori providers, then we actually need to manaaki each other. And, it should be about, reaching into some of the big providers and going, hey, can you help us? Can we do some stuff, because, you know, we've had that approach from marae all around Waikato, and we're more than happy to awhi that. And I think yes, MSD is a problem, but actually all the funders are a problem. But what we're really good at is we never ask for permission from the Crown. We just get up and we respond. And I think that's the way, you know, we're not going to send whānau to MSD. I saw a comment in there when it takes 3 days to get a kai. You got to feed them that day. You know, and we're really good at being able to use our networks to do that. I think if we get too attached to the funders, then we end up we don't meet the needs of our communities. Yep.
And so I take it you got to do both things. You got to get kai to that whānau, but you've also got to advocate to Crown, to the ministry, say that's not good enough, whānau not waiting 3 days. So, and you've got to support your other providers. So we've got to get kai to a whānau, we've got to support Māori providers, and we've got to challenge, let's call it bullshit. When bullshit happens, we've got to challenge it. Okay. I saw a question there about rongoa practitioners, and I want to do something different now. I think the answer is yes, there are going to be rongoa practitioners who are providing alternatives to westernised medicine. I don't prescribe rongoa because I'm trained in the Western Orthodox, but I'll bet you that some people know what the answer there is, are people who are providing that service, because our whānau want that. That's right. So if you know and you'd like to share that, type it into the Q&A. Instead of being a question, just make the statement of you know, so that other people can see where to access rongoa providers. Great.
Yeah. There's a couple of questions coming up around Healthline. I think how well staffed Healthline is. I think it's like any phone line, you know, when a large volume of calls come in, you know, there's only so many people to answer the calls. They've struggled in the peak of the pandemic. I think generally their call wait times have dropped off. There are certain times of the day that are busier than others, obviously, and that tends to be less now because all the PCR reports don't come out first thing in the morning. Everyone's doing their rats all throughout the day, so that's kind of smoothed it out a bit. We have had some of our providers sort of step in and provide support within Healthline, so taking especially Māori and Pacific providers supporting Healthline as well to get a better service when they call through. So we've adopted the approach that obviously they're a big organisation and we want to get in there and make a better experience for them when our people call.
And having said that, lots of Māori providers are making sure that there's an 0800 number goes straight to them, because, you know, that's a really direct way. Great. There's a question in there about, can you share your 3-question screening, the breathing thing? So yes, we can. We're going to get that up on, it might be on our webinar stuff when we post it, or it might be typed in shortly. And it is about if somebody can complete, you know, sentences. Are they talking in sentences as part of it? The question about how are they today compared to yesterday? Are there things they can't do today that they could do yesterday? Those kind of questions, and that's great. We'll do that.
Kia ora, Robin, nice to see you. We have in some cases partnered with local tertiary providers to extend the reach, and we were just talking about this, even partnering with Kura as a way of distributing rat tests and also masks and PPE as well, just to get it through as many avenues as possible. So yeah, I definitely think engaging with tertiary care and wānanga to use their demographic and locations is an important way. Another question, do our non-vaccinated whānau have access to health records? If not, how do they record their results? So they can go online, and yes, they can set up a My COVID record and record their results there. And we definitely are trying to encourage people to do that, just so that that's always there in the background for them to refer to if they ever need it in the future.
Just remember, some people need help with that. My COVID record, I'm just saying, put my hand up. I needed help with that. And so, again, it was something we talked about earlier. If you can be part of helping somebody to get it, I can see you laughing there, Terina, but you know it's true. I needed help with that. Over.
Cool. There was a question that someone may have already answered just about long COVID. And obviously, that's kind of the future state is, although we may get through the hospitalization peak that's just around the corner, what are we going to be left with in terms of long COVID?
I thought that was something interesting, might even turn to providers. Have you started seeing a bit of long COVID? I mean, we kind of work in the health system and we're aware of it from right back in the original outbreak and the Marist cluster. And, but let's check in with our provider network. What's your experience of it? We'll go Teara and then Te and Terina.
To be honest, I don't know if we've come across any. It's probably something I can check with our team. But we have seen whānau have Delta and then come back with Omicron. So not too sure if any of that is related. I'm non-clinical, so I can't really comment on that. Sorry.
No, we haven't seen a lot of long COVID, if any at all.
We haven't seen it either, but we are pivoting because I expect we're going to see it.
I think we have kind of been spared given our low case numbers, possibly what we've seen overseas. You know, it's not a guaranteed outcome when people get it. I guess, you know, I was just talking to someone before saying the idea of just going and getting it over and done with doesn't take into account the fact that, you know, if you can avoid getting it, you can also avoid getting long COVID. So that's always the counter conversation that I have with people. Hey, it's better just not to get it at all. That would be my advice. And we still need to remember that people every year manage to avoid viruses, and you can still avoid this virus. It's just a lot harder.
Tessa Robbins got a question there. The rules keep on changing. She's mentioning about the isolation rules, but you know, it's not just that. There's other things regarding vaccination after you've had COVID. Whānau are finding that frustrating. How are you guys dealing with that? How do you keep up to date with the information changes?
It's me, don't you, Teara?
I was going to say we're quite lucky to have Dr. Sean Hanna, who's up to date with all of the latest rules in terms of vaccinations and when people can get it. So we haven't really had an issue with that, and we're just getting the messages out to our practices and our community teams.
I have to say it's very frustrating from our end. I'm not going to lie. It changes every day. It's not clear, you know, and often too, it gets announced and then it gets passed on to the provider. So, you know, you find out after the general population, the new changes. And so my source of truth has been Daudi and Anthony. I will go back to them and email them and ask them. And I did that today as well. But I have to say it is frustrating. And that's, I know from our clinicians' perspective, from our kaumahi, and what we've tried to do when we can is to reword the information and post it online so that it's easier for whānau. But yes, frustrating.
I agree. But what I think has worked is actually when iwi take control of the comms and then they tailor it, or, you know, Hauora or Māori organisations take control of the comms and they tailor it. They seem to do a good job at just at the tone and how it's really easy to understand, I find. But a lot of the stuff that's coming out of the ministry, it's a bit of a hoha to be honest. I always look for the Māori comms rather than the Pākehā comms.
Yeah, fair enough. And Tessa, just deliberately on the vaccination side of it, I'm with you, I'm with those whānau. And so it's the difference between rules and advice. The Ministry of Health has got advice about recovered whānau when they should get their next shot. Fair enough. Take that as advice. Actually, as a clinician, I can say, yep, if somebody wants to get vaccinated, I can deliver on that. And it doesn't matter if they are isolating, if they're recovered, if they're a probable case. All of those things are interesting, but there's no contraindication to them getting vaccinated. So I'm okay about making sure that whānau that want to access vaccination can get it. And I always make sure that they notice the ministry's advice. The ministry's advice is not rules. The rules are, here's the medicine, this person's allowed to have it, I can prescribe it, they can get it. And so I guess that part of that is trying to get close to some good health services that will work with you and work with whānau and get them what they want when they want it. So I hear you, it is complex, it's hard, but we should break through because we want to serve whānau.
And I think that's, Teara, what was in your email that we were talking about today is actually you just got to work with the situation, and actually turning someone away and making them come back is the worst outcome that we could have. We just got to work to maintain that engagement.
Yep, and I'll tell you same thing about the liquid paracetamol question. Beautiful question. Notice when you go to the supermarket, you can't buy liquid paracetamol. So our retail rule kind of holds true. Liquid paracetamol is going to have to come from a health provider. We've got to keep our babies safe. It's really important that they get paracetamol, get through COVID, but it's going to have to come through a health provider. A pharmacist can provide it, by the way. Go to the pharmacy.
Hey, this is a good question from anonymous attendee. How do you know what's around your hand if you're doing a rat, and do you think it's important?
Is it?
Well, maybe. I guess probably not. Now we're all Omicron. Now the Delta's faded away.
So there's the key. The answer is really there's nothing but Omicron. We know that from, we've had a couple of months of that in Auckland. We've had nothing but Omicron here. And I know the testing outside of Auckland has reached the same point. There's no Delta left, as far as we can tell. So yes, you're right. Intellectually, it's right to try and find out. But actually, what we know is there's nothing but Omicron.
And the perennial question that always comes up is, do you think we'll need another booster?
Yeah, I can see that question coming. Yeah, maybe, but maybe not. So yeah, we're in that point now. And I guess 6 months ago, I would have guessed that we were going to probably end up with boosters, you know, like the flu jab and the COVID would have that every year. I'm not so sure now. I think there's more to discover about this Omicron situation. It probably will become part of our total immunisation package over time, but it might not be Pfizer. So yeah, we've got some things to discover on this one. Hey, lots of mihi to you, Terina, to you, Teara, and to Te. There's just people, and it's beautiful. If you want to type your mihi into them, use the Q&A to do that, absolutely. Thank you for joining us tonight. Somebody's typed in there where you can get some information for Watautahi, ngā mihi kia koe. Thank you for sharing that. I'm hoping that somebody's typed in something about rongoa practitioners. Please share that information. Terina said it earlier, we've got to get through this together, and Māori providers supporting other Māori providers is part of that. Whānau supporting whānau is part of that on a day-to-day basis of getting through Omicron. Yeah, so the key messages are about how we organise and support each other. Look after your workforce. Your workforce is going to go through a time when 20 or 25% of people are affected and isolating. Have a plan for how you're going to organise work to get through that. Who can work from home? What gear do they need? How do people, get their rat test done so that they are, identifying early? There's all of those things we've got to do. My job now is just to thank our panellists. So koutou waku tuahine ka mihi kia koutou. Our panellists who have been on with us tonight, our team who have been supporting us, the Question Meister, and our sponsors is Wirohia and Uruta and Ngā Pai o Te Māramatanga. Ka mihi kia koutou katsua, koutou I tūhono mai tēnei pō, tēnā koutou, kia ora tātou katsua.
tamanui te rā e ki Ki runga i a whaira wae Heke mai ko te marangai Wai puketia Ngā tiriti o te motu E te tangata e ki Ka whiti ana tamanui te rā e ki Maranga kia mau kia ita He runui, he ruroa Naru wai moko te runei ha Kia hakarongo te ao katoa Wa he katoa te pā Tirohia ngā whenua Tirohia ngā moana Tirohia ngā tangata Wariro atu rā e ki Ka whiti ana tamarui te rā e ki Ki runga i a whaira wae Heke mai ko te marangai Wai puketia Ngā tiriti o te motu E te tangata wae ki Ka whiti ana tamanui te rā e ki Maranga kia mau kia ita He au nui, he au roa Nā tangaroa te au nei ha Kia are te ao katoa Kua he katoa te wā Me hoki haka murira Ki ngā kupu o rehera Toi tū te kupu me te mana Toi tū te whenua Daram 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 bam
Kia ora tātou. Thank you for joining our webinar on Omicron tonight.
And we just wanted people to be able to ask questions and have answer their worries and then go away and think.
You know, for better or worse, we are still in a really good position compared to some other countries who've experienced these big surges.
We've got to protect our workforce, probably like all Māori providers. The issue I have is trying to stop our kaimahi from trying to work 24/7.
So COVID's not only an infectious disease, it is a mental illness pandemic as well.
It's a very normal human neurological reaction to become hypervigilant, or in other words, on edge, when faced with uncertainty and change.
Actually, it's less about infectious control and it's more about saving Māori lives.
And kia kaha tātou, we can do it because we you know, Manaki's in our bones and we can look after each other, and I think that's where it's at.